Thank you very much and welcome to this special program. I am broadcasting here from my home. I am isolating. I'm working from home, and I think tomorrow I'll be in the office. But today I'm working from home as well today, and I did promise that this is going to be a series that we will be doing every day until we see the surge going down. I think it's important we speak to the health officials and also speak to our people, let them know the importance of fighting this disease. I think also we need to equip our people with all the basic information that is needed for them to keep themselves safe and their families safe. So that's why today I have, yesterday I had the Director of Health Promotion, and I think it was important to give us from the Ministry of Health the current situation of the country. And of course, tomorrow I'm going to have the members of the, I think it's the Health Medicine Board, because there are some developments. There are some hospitals and clinics that are doing tests on their own without the approval of the ministry. So we will be talking about that as well. But today I have the honor of having Dr. ISMAIL BADJIE. He's the CEO of INNOVARX Global Health. Yesterday I did tell you guys how I was really scared, how I felt when the corona started in March. I was just basically staying home. I was not leaving my house and I didn't know what to do. I watched one of his videos and I invited him on Kerr Fatou. And when we met before even we started the show, I remember you giving me some counseling and how instead of getting frightened, instead of getting worried, what I should do, how I should help myself and loved ones. And that really empowered me. I did share my story. That really empowered me. And with a couple of videos that I watched on YouTube as well, I was able to get myself prepared and my family. And I can be infected because I know I go in contact with so many other people. But I know that I'm taking so many precautions to make sure I stay healthy and my family members stay healthy. So that's why I shared that story today, but that's why I wanted you to come today to help me share my experience with your team and also what basic stuff that people need to do. I know that I have also recommended so many people who have got symptoms and some even had breathing problems. Help was not available. So we called you and you were able to do telemedicine with them and gave them some supplements, some medications. And today they are stable, they are isolated, and you are talking to them. So these are some of the things. We know the government is overwhelmed, Ministry of Health is overwhelmed, and that's why private people like you, this is where you come in, how to give us support over the phone and also give us some recommendations. So it's an honor to have you to share this platform once again and talk about, some of these issues. Thank you for joining us once again, Dr. BADJIE.
Thank you, Fatou. It's always a pleasure. I think you from day one has done a good job with making sure you're giving people good information. And like you said, as a private company, we're the company of the people. We really hold the gambling people at heart. So we just try to see what we can do to help as much as possible. So it's an honor to be here.
Yeah. So first, I know, last week, I just want to give an update to the viewers. I know yesterday when we had the director of health promotion, we did ask the status of the president because a lot of people were worried and he didn't have the answer. But just 5 minutes before coming into the show, the State House have sent us a release. I'm just going to read this release to the public. It says, the public is hereby informed that His Excellency Adam Barrow, President of the Republic of the Gambia, has tested negative for coronavirus. The president's sample was taken on Thursday, 30th July 2020, and the results came out last night, Monday, 3rd August 2020. The Office of the President seizes this opportunity to wish all those infected speedy recovery and pray for the departed souls to rest in eternal peace. Stay safe, join the fight to contain and stop the spread of COVID-19. And Director of Press, Ami Boja. I think this is very, very important.
It is.
What I've seen, it is very important. What I've seen over the past few days is people worried. People were worried that we don't know the status of the president. People wanted to know what is the status of the president because the vice president tested positive, a couple of ministers tested positive. So it's important that we know the status of the president, and it's clear that the president is tested negative, and we are happy that he's safe and he's isolated. This is the leader of the country, and it's important for every Gambian to know that he's tested negative. What does this mean for us, all of us? It's a lot of, it's boosting the morals, right, Dr. Badjie?
Yeah, so I think for one, I mean, alhamdulillah, that he's safe, but also we should always start by wishing people who are already in recovery, a speedy recovery. But I think if you peel the layers, this shows us a couple of things. You mentioned that the president of the country got his sample collected on the 31st.
On the 30th.
30th, right? Thursday. Today is August 4th.
Yeah.
So if the president of the country is taking almost a week, right, to get results, what does an average Gambian who lives in Sukuta, what are their chances of getting a test sample and knowing their results at a reasonable time, right?
Very important point, very important.
Right? So I think it shows you how depleted our resources are in terms of testing. But I tell people, if you normally quarantine people, we've been doing it for the past couple of months, you quarantine people for 14 days, normally.
Yeah.
If it's taking 7 days to get your test results, or 6-7 days for the president, we could anticipate that we will get to a point where it may take 14 days, 20 days to get somebody's test result. So at that point, one, our quarantine strategy is no longer effective because the person, you could be at home for like 15 days before you know if you're positive or if you're negative, right? Which is why I think the conversation should start becoming, you act like you're positive as soon as you start having symptoms while you wait for the testing.
I heard you say this. I heard you say this on Twitter. I saw a post that said, let's start acting like we're all positive.
Yes.
Why do we have to do that? Why?
Because the way the virus works is, as soon as you're infected, at that point, you run the risk of giving it to people around you, right? And people have to remember, the test that we're doing is not testing for immunity. So the president of our country, President Barrow, alhamdulillah, he tested negative as of today. But the pandemic doesn't give you immunity if you test negative. So you could test negative today and come in contact with the virus tomorrow and test positive. Because our testing is not testing for immunity, it's testing for active virus, meaning people who are infected.
Yeah.
So I hope people don't see a negative test as I'm scot-free. That's not the case. Because with community transmission, you could test negative 10 times, and on the 11th time you test positive because that's when the virus came in contact with you. So it's extremely important. So symptoms, some people are asymptomatic, meaning they don't have a fever, they don't have a cough, and they could test positive, which is why the mask wearing is important. I tell people now, even at home, people should start wearing masks at home. Because you never know what somebody's exposure is. And the nature of community transmission, once it's in the community, it does not matter where you got it from, it's already in the community, right? So it's almost better act as if you're positive by wearing a mask, washing your hands, keeping your distance. And that way, even if you don't get access to a test, one, you have to realize the moment you're infected, your immune system has already started fighting the virus.
Yeah.
That's what people need to understand. You don't have to get tested for your immune system to be like, okay, the time is up now, let me start fighting. That's not how viruses work, which is why some of the symptoms like a fever, like body aches, all those things are signs that your body is fighting something that does not belong in your body, which is why clinically we tell people a fever is uncomfortable, but a fever is a sign that one, there's an infection, but your body's military, which is your immune system, the process has already begun. Which is why I think as a country, we should start shifting from what could we do to prevent it? I think it's rather too late. It's already in our community. For a lot of individuals, you know, it's a matter of when I get it, not if I get it. That's how community transmission works, right? So prepare, we need to start educating people on what do you do when you start having symptoms? Because the moment you start having symptoms, you could already be positive, but if it takes 10, 15 days to get tested, just go ahead and act as if your battle has already begun. You protect the people around you by wearing a mask and do what you can. So that's what, as a company, we decided that, okay, we can't control testing. The government infrastructure is overburdened. We can't control the minority of people who are going to need advanced care, right? Which I think one of our conversations, I reminded you, one of the reasons why we should not be too afraid, there's two reasons, right? Every time we're stressed, psychologically, we're actually reducing our immune system. Because your body starts producing all these stress hormones like cortisol. So your state of mind goes a long way to make sure your immune system is strong than vitamin C would. And we'll talk about vitamin C in a second. So one of it is not fearing COVID, but understanding COVID in terms of it's in the community. Risk is very high, especially people like us, healthcare professionals, our risk is very high. What do I need to do to protect myself by getting my immune system ready, by wearing a mask, by washing my hands? And what do I need to do to protect people around me who may not be fortunate enough to have a strong immune system because they have diabetes, hypertension, they have weight issues, which puts those people in the high risk category that when they do get sick, those people's oxygen levels start going down and they need oxygen. The Gambia is in no way, shape, form to be able to give all the people who are gonna need oxygen if that was to happen, right? So part of it is just understanding it. And I think that's where good information comes into play. And I think even from a sensitization standpoint, I would hope that as a country, we start, yes, we've done the preventative stuff for 5-6 months. We've seen that Gambians are recalcitrant. We have a carefree attitude when it comes to diseases. We had way too many conspiracy theories. So we've missed that opportunity. There's nothing we could do at this point. Blaming the government would not help because the people are the government. So if you say the government did not take it serious, no, Gambians did not take it serious. So we just can't point fingers around. We need to see how do we become responsible? How do we become more disciplined? Because a lot of countries that are fighting COVID successfully, a common trend is their citizens are disciplined. Meaning if they wake up and say, citizens of country X, we should all wear masks to stop this disease, majority of the people wear it. Gambia, everything is either political or it's conspiracy theorists or it's, religious reasons. So it just makes it harder, right? And I think it's made our situation a little bit harder, but there's things you can do. There's things you can do.
There's things we can do. So let's start with what do we need to do if at all basic stuff, even without signs and symptoms. What should I do now that we know this virus is here and you just want to protect yourself? What do you want? Should we do?
So the first thing I think everybody should do should understand that without no doubt, coronavirus is real. Africans are not immune to it. No matter how religious you are, you're not immune to it because you're Christian. You're not immune to it because you're Buddhist. It affects every single person of any color, creed, sexuality, gender. It does not care who you are. That's one. It's just something that is attacking the human race. So you have to believe that. The second thing is protect yourself from bad information, because bad information leads to bad decisions, right? So we need to police our WhatsApp groups, especially with elderly people who are telling them if you wash your face with seawater, you won't get corona. So we have to just get the good information, right? And then we come to what you could do for yourself, for your body. As I mentioned, your mind. We have to start having a conversation in the Gambia about how stressful situations affects people's mental health. It causes anxiety. It causes a lot of depression for a lot of people, right? We have to acknowledge that certain things in our society, we cannot stigmatize anymore. But even if it's not corona, anybody who has a stressful environment, by nature, your body is going to produce a stress hormone called cortisol, which is going to decrease your immune system, right? So mentally, we have to make sure we're in a good place. We're talking to each other. We're checking in on people who may not have a strong support system, because that in itself is going to boost your immune system. And then you could offer somebody help. If you talk to an elderly woman every single day, ask them, how are you doing? How are you feeling? Because the sooner you could make an intervention, that could be life-saving, right?
Yeah.
So individually, the supplementations, I tell people, just because if Fatou takes 1,000 milligrams of vitamin C, and I take 500 milligrams of vitamin C, it does not mean that Fatou is more protected from coronavirus than I am, right? So I think people have to be very practical. Do not take so much of your money to buy supplements and vitamins when you could eat a balanced diet, find a good multivitamin that has a combination of zinc, vitamin D, vitamin C, which every adult who is not eating a balanced diet, even after corona, should be taking a multivitamin, because it's a supplement, as in it's supplementing something that you don't have enough of, because some essential nutrients like vitamin D, if they go low, it could have some implications, right? So every single person find one supplement that gives you vitamin C, gives you the nutrients that you need, that is affordable to you, and just take it every single day. But you have to realize that there is no science that says that if you take X amount of vitamin D, if you take X amount of vitamin C, if you take X amount of zinc, you are immune to coronavirus. That is a myth. It does not exist, right? So just find one immune support that gives you everything you need, one multivitamin that gives you everything you need, and just take it every single day. That's step number one. And that's something to do if you don't have symptoms, whether or not you have symptoms, right? So in terms of symptoms, obviously coronavirus, what we're seeing is the common ones, right? A fever, right? A fever. So we'll start with the fever. Once again, a fever is a sign that you may have an infection. That's why infants with babies, the moment their body is running hot, if they're running a fever, that's one of the clinical indicators that they might have a fever, right? So they need to take something that would help bring the body temperature down, which is a fever reducer. So that's where products like Tylenol, for example, acetaminophen is the same thing as paracetamol, right? That's designed to help your fever. So it's a pain relief and a fever reducer. So you could either take Tylenol, or you could take ibuprofen or naproxen, right? From a pharmacy standpoint, I tell people Tylenol, I tend to recommend more Tylenol, because it's not an anti-inflammatory, meaning if you have an inflammation, Tylenol is a good general pain reliever that reduces your fever. And some people who might have conditions like high blood pressure or chronic kidney disease, they should stay away from taking ibuprofen, too much of it. because ibuprofen,
Okay.
your kidneys process all the ibuprofen that we take. So especially if you're taking it constantly, that could have some implications, right? But just find a good fever reducer like Tylenol or ibuprofen. It comes with kids one as well too.
Okay.
I tell people with kids, do not use a spoon at home because Tylenol and ibuprofen is dosed based on a child's weight, which is why at the back of most of the boxes, it'll tell you your child's weight. If it's 11 kilos to, let's say, 15 kilos, this is how much you give, which is why most of our children's medications at INNOVARX, we give you a dosing syringe, which now we could tell you your child is 10 kilos. You know, you could calculate the dose of Tylenol for a person that weighs 10 kilos, and you give them the appropriate dose to help reduce their fever, right? So in terms of fever, Tylenol, ibuprofen, the liquid version for kids, and the like. One of the next symptoms that we have is cough. It could be a dry cough, meaning you don't have no mucus, or it could be just a general cough where there's a lot of mucus, so you have phlegm coming. Just find a cough medicine that will help suppress the cough. Some of them come in liquid form, right? Most of the ingredients to look for is dextromethorphan, and you'll see it most of the time, it'll say DM, right? The DM means it's for cough. It has a cough suppressant in it. So normally it comes in liquid form or it comes in a tablet form, but you just want to make sure the ingredients, dextromethorphan, DM is something to look for, right? For some people who don't like taking medications, you could take cough drops.
Cough drops.
Yeah, a lot of the cough drops just have menthol. So menthol is actually one of the best, not best, but it's a really effective cough suppressant, right? Which it doesn't affect a lot of your system. That's why even with a lot of infants, babies, if they have a cough, instead of giving them a cough, take some baby rub that has some menthol. If you rub it on their chest, on their feet, just the vapor of them inhaling the menthol acts as a cough suppressant. So a lot of these cough suppressants just do just that. They help you suppress your cough, right? So once again, which is why people need to understand there's no cure for COVID. Your immune system your immune system is gonna fight it whether or not you have something for the fever, which is why the treatment plan is supportive care. You treat the symptoms and you let your immune system fight the fight, right? Which is why things like when a vaccine is available, which more than likely, if you think of Gambia, and we have a really good vaccination system as a country, something we should be proud of actually, and the Ministry of Health, you know, deserves a lot of credit for our vaccination. So one, children vaccines, I know it's off topic, but just because we're in the season, make sure children are still getting their scheduled immunizations. That's really important. But when the vaccine is ready, that will kind of help minimize the spread. But for now, a couple of things I want to mention, because this week we've had a lot of people come to our pharmacy trying to get azithromycin, which is an antibiotic, trying to get hydroxychloroquine, which is an anti-immune, people that have immune disorders like lupus take hydroxychloroquine. Please do not self-medicate with antibiotics. That is something that is a problem in the Gambia. I think a lot of establishments should not be selling individuals antibiotics. Somebody taking azithromycin is not going to prevent them from getting coronavirus. Somebody taking hydroxychloroquine, which the two, when combined, it could have very serious side effects that affect our hearts, right? So that's why before you just run into a pharmacy and ask for an antibiotic, first of all, just logically, coronavirus is a virus. An antibiotic is used to treat a bacterial infection. So you taking an antibiotic to try to treat a virus infection, it doesn't even make sense clinically, right? A lot of people in hospital systems, you could get coronavirus, and one of the secondary issues, you could have pneumonia, or you could have a respiratory bacterial infection, which at that point, clinically inpatient, some may use azithromycin to treat it. There's a lot of studies that are going on. Some people, the medical community, I think you see both, but as the general public, we should not consume antibiotics generally, right? Unless you have a bacterial infection, right? Treat the symptoms, and if you have it, just support your system and let your immune system fight the fight. That's very important. For individuals that have diabetes, hypertension, asthma, the smokers, the people who are morbidly obese, meaning they're heavier than they should be. Now is when you should be protected more than anybody else. Because those individuals—
Why do we need to protect people like that?
They are considered high risk, right?
Okay.
They are considered high risk. One of the things that coronavirus, like the flu, could do is it causes an electrolyte imbalance, meaning people's potassium levels could go down. Some people's kidney function could go down, their liver function could go down. So those people should not be missing their medications anyways. But we've seen that a lot of those individuals, when they do get corona, they could fall into the category of people that get the severe case of the disease, which once again, people need to understand, those people are in the minority, right? If 100 people have coronavirus, what we've seen is majority of the people will have mild to moderate symptoms, meaning you should not get sick enough to have to be admitted at an ICU hospital, right? Which we should thank God as a country. But because if majority of the individuals needed oxygen therapy or needed ICU beds, the pandemic will have a greater effect on a country with limited resources, right? But these classes of people that have non-communicable diseases like diabetes, hypertension, diseases that me sitting next to you won't give you the disease. I use myself as an example. I have hypertension, right? Meaning I am technically in the high risk category. So I am making sure that I'm not missing my medications every single day. I'm making sure I'm eating a clean diet. Same thing with the diabetic patients, right? And I think some of the health systems, some of our doctors, Dr. Morena was mentioning that the other day, is all our resources as a country are going towards coronavirus right now. But that does not mean that diabetes is on vacation. You know, hypertension is on vacation. All these diseases need to be managed, and those diseases themselves could cause complications. So if your parents, your loved ones, your elderly people, the best thing you could do to protect them is always wear a mask when you're around them. Make sure they are not going home. Keep them at home. Do not allow visitation at people's homes if you have the luxury to do that, right? Because once again, we've gone the path of asking the government to do things when we are not governing our own households to protect ourselves, right? So the young person who's 25 years old, who might have a little bit of a nonchalant, carefree attitude, might refuse to wear a mask. But every time they wear a mask, they are putting an elderly patient's life at risk. And Gambia is very small. We've seen it this week, the amount of individual loved ones that we're losing at such a fast rate, when we cannot point to the government. As a society, we need to protect the most vulnerable. And these individual patients who have chronic conditions that they're battling with every single day have to be protected as well.
So the other thing that I also wanted us to look at is the rate of how the elderly that are dying. Because what we have seen, what we have observed is that the elderly people that mostly have underlying conditions. And most of the time, these people don't go out. It's us, the young people, that go out, bring the disease and transfer it to these people.
Yes.
So, and it seems like that's why a lot of us are thinking, oh, no, we are not, young people are not dying, mostly it's the elderly. But who is giving the disease to these elderly people? It's important for young people to know. Most of them are carriers, but because they have strong immune system, they might not just die easily, because they are young, they don't have land conditions. So the disease is going to take time before they get full blown. So
Absolutely.
I think it's important for us to look at the role young people are playing in bringing the disease home and giving it to our elderly people. That's why I've always said I am so concerned about my old grandmother, because everybody comes in. I make sure we close the doors, no visitors allowed, because I can have the disease and be carrying it, and it might take time before it even, it gets full blown. But for her, she has all these underlying conditions. So what is the importance of young people knowing the role they play in transferring this disease to the elderly at home?
100%, which is why I have been an advocate over the past couple of weeks of people wearing masks even at home, especially if you live with an elderly patient, especially if you live with somebody who has chronic conditions that put them at high risk, right? Because we have a strong, even though something that's going to happen too, we're going to lose some young people due to Corona as well too. Every health system, maybe we'll lose the most frail because we don't have a health system that is more preventative. A lot of Gambians go a whole year and they haven't done the comprehensive screening that you have done, that I have done. So these underlying conditions, they don't know that they're diabetic. They don't know that they're dehydrated. So their state is already frail anyways, but young people have such a huge role to play. And we also have to realize when it comes to sensitization, my grandmother is not on Twitter. My grandmother is not on Facebook. If anything, she'll probably watch the news in the evening. But young people, our sensitization, sometimes we think Twitter or Facebook is the whole Gambia when it's the minority of Gambians. So young people using good practices like wearing a mask, telling them their grandmother about the severity of the disease will go a long way with making sure we could fight it the way we do. But absolutely, we have to protect the most vulnerable.
And also, I know that, like I said at the beginning, our health system, we all know no country is prepared for this virus, not even America. Right now, they have the highest number of people infected and the highest number of deaths as well. And so it has been a problem for every country, but Gambia is no exception. What we have seen is the stress it has put on our health facility. A lot of the health officials are infected. So what do you think should be the way to handle this virus right now, especially at health facilities? Because I have symptoms and maybe I call 1025, they're not picking me up, because right now that is the scenario. You call 1025, you call the numbers, they'll tell you, sometimes they don't pick, but even when they pick, they keep you waiting for days before they even pick you. So somebody who is sick, who is not privileged to know somebody like Dr. BADJIE or to know other doctors, will just walk to the nearest hospital. And once you get there, you get into the hospital, you come in contact with patients and health officials. And this is how most of our health officials are contracting the disease. So what do you think we should put in place to protect our health officials? Because if all of these people are sick, who is going to take care of us?
Yeah, and that's a really tough question, because I almost feel like that's a conversation maybe we should have been having in February and March, because the nature of community transmission, I mean, just working in a healthcare facility, I know for a fact every single day I'm coming in contact with people that have the virus. The government or institutions, health systems have to be a little bit more creative now. And I think, for example, and the government systems are a little bit more challenging because there's a lot more bureaucracy and things like that involved. So it's easier for the private sectors to make decisions like, okay, let's use telemedicine for every patient who has symptoms, that way they're not coming into the facility. But I think PPEs, providing, healthcare workers with a lot of PPEs, a lot of compensation, a lot of compensation. We should, just a lot of compensation, right?
Okay.
And because it's almost counterintuitive, because our strategy in the beginning at some point was like, the moment you come in contact with somebody who's quarantined, you're off the workforce for 14 days. whether or not you have symptoms,
Yeah.
which I think had a burden on the system. So it's really tough to see that, okay, this one solution is going to save the healthcare workers, because it's not. It's almost we have to prepare for the absolute worst, where a lot of health facilities are going to be either shutting down or closing, which is why the most important health facility that we have is our homes, to be honest, at this point, right? Because if you have symptoms and it's taking too long to get tested, start isolating at home. Start taking supportive care. And when help arrives in the form of a test, right, you could get tested, right? But our health systems are going to be overburdened for the foreseeable future. What we could hope is the individual healthcare professionals that do get infected have a speedy recovery like any other Gambian, right? And then they're able to come back to the workforce, right? So I know it's kind of intuitive, but the fact that maybe some healthcare professionals were the early cases might be a blessing in disguise, because that means there was less of a burden in terms of a COVID burden. Hopefully, a lot of them will recover faster, and they're able to continue their, their endless sacrifice that they do every single day to kind of help more people. Which I just hope every single time we talk about how bad the system is, let's realize that every healthcare professional has a family, they have kids, they have daughters. So let's be empathetic to what they are going through as well too. Because even before Corona, healthcare professionals have been performing magic in the Gambia, because they're doing so much with so little. So if we can praise them and pat them on the back, let's not point out the obvious, right? Because the Gambia, in my history, we've never been to a place where it's healthcare professional heaven. Let's try to get through this, learn from it, and make sure health sectors like health, education, they're non-negotiable when it comes to investing resources to the people that matter. But for now, we just have to weather the storm. I don't think there's any one solution that's going to protect the level of exposure for a lot of healthcare professionals. So let's just pray that the exposure is limited, and the ones that do get the virus, we wish them a speedy recovery, because a lot of them will recover, and their natural inclination will be, okay, it's time to go back and help people. So they deserve all the credit.
So let's talk about the care plan that INNOVARX is offering. I have told so many of my friends and family, you know what, you just need to get this plan, because I think it's important. I have said this even yesterday. At this point, it's up to all of us to take our personal precautions. At this point, we all know that our health system is not fully equipped to take care of all of us. So for me, it's like, I'm gonna take care of myself. I wanna take care of my grandmother. I wanna take care of my dad. I wanna take care of people close to me, so that in protecting them, I'm also protecting myself. And that's why it's important for people to know that they can help themselves. And I know I have recommended people to you guys, and some even had signs. They were not able to get help. And you were able to establish telemedicine and provide them some support, and they are stable. They are stable as we speak. Up to now, they are not able to get help from the Ministry of Health, but we don't even know what their status is. But because they have all the symptoms, you were able to help. So for somebody who has this kind of symptoms and the help has not come from the Ministry of Health, when they contact you, what do you do with them? How do you help them?
Yeah, so the first thing we advise them is, if you're at home, get a mask, keep it on, and don't remove it. Unless you're one of the few Gambians who live alone and don't have any human contact. That's one. Two, if you have the privilege, which a lot of Gambians don't, of having a room in the house that your family could isolate you, do that. Those are first things. Start governing your household. Number two is, don't come to our facility, because whether you're positive or negative, there's nothing we could do different inside our facility. And I think that goes with a lot of health systems. What we will do is we'll start monitoring your symptoms for you, because when we started as a company, we invested in telemedicine as one of the services. We did not know that 2020 was going to be COVID. So we have all the technology in place to the same way I'm having a conversation with you, I could be telling you, okay, Fatou, I just sent you some items to kind of monitor you. Let's start by getting your body temperature. If your body temperature is reading 38, which is a sign that there's a fever, go ahead and take 2 tablets of the pain reliever that we sent you, right? Are you coughing? Yes, no. So we could do everything that we could do if you were sitting next to us without jeopardizing people by you getting in a car, going into the healthcare facility. So it's, to me, I've always believed that telemedicine, telehealth is the future of healthcare. I don't think you should be able to leave your house, go to a hospital system, sit there for 5 hours when I could just have a conversation with you and have a clinical experience. And we're getting to see it now and it's effective. But even if you don't have symptoms, the value of the supportive care plan is, the keyword is supportive. Once a day, we'll call you just to make sure mentally you're okay as well too. So that we could calibrate your expectations to tell you, I'm glad you're feeling okay. Let's make sure you're not dehydrated. If you could walk back and forth or do some exercises, stretches, do that as well too. But just to reassure you that your body is fighting, hopefully you're gonna be okay. But I think one of the most important things is with the telemedicine is, if you, for example, let us know that, okay, I'm having difficulty breathing, clinically, the next step should be, okay, we need to monitor their oxygen level, right? So we can make arrangements for your oxygen saturation to be measured, which if it drops below the desired point, at that point, you need immediate support, meaning you need oxygen. So the fact that somebody is checking in hourly with your body temperature, you just text us your body temperature, we record it, we're able to support you with the supportive care items that we sent you, but we could see if you're deteriorating and we could at least help you get the interventions that you need. So it's just designed to create a health system that is safe for the healthcare professional. You have the products you need, and then we could just help you on the road to recovery. But I mean, we don't have any healing powers too. We can't cure the disease, but at least we could tell you what to expect and how to support yourself through it. So that's what the telemedicine, the telehealth is doing. That's what the supportive care plan is doing. And hopefully even after Corona, a lot of health facilities will invest in telemedicine. For example, Bundung Hospital, we've rolled out electronic health record systems with Agasta. So right now, Bundung Hospital has telemedicine technology. So hopefully they could use it to leverage their contact with patients, because not every encounter with a healthcare professional has to involve the healthcare professional being close to you. Part of it is just continuous care, electronic health record systems, knowing what to take. So that's what we're doing, and I think it's been of value to a lot of customers, and we plan on doing it more often.
And the question is, I know a lot of people have contacted us through our page and they're asking for your information. I have personally given out your numbers to a lot of people, and which you were not bothered with, but also the supportive care numbers we have also given out. But how equipped and what capacity do you have to manage a lot of these patients? Because I know a lot of our followers are in the diaspora, and most of them will call and they're interested in buying this care plan for their families, even though they know they're okay, but they're worried about the surge in the country. They want to make sure that somebody is taking care of them, because that is important. Somebody, you have a healthcare official calling you once a day, making sure you have taken your tablets, sending you all the care plan, the cough drops, the immune support. I love the immune support. And I always say the good thing about your medications, it reminds it reminds me of CVS. And I am that person who doesn't like the smell of medicine, but the medicine, the American medication, of course, they don't come in with scent. So, you can take any medication and don't worry about the smell, because whenever I take those kind of medication, I throw up. So that's what I like about your system. But for a lot of people who are in the diaspora and they want to buy this care plan for their families, because I know some of them have contacted me to say they want to do this. They know their people are okay, especially people with diabetes, with high blood pressure. They want to make sure somebody is checking on their family members. They want to make sure they have all the support. Right now, the medication that we will bring from the US, we're not able to do it. It's expensive to do DHL. No one is coming. So yes, just last night I was talking to a friend in the US, and she was, my mom's medication finished, and can you link me to INNOVARX? Maybe they can do telemedicine for her to talk to her doctor. I said, yes, they can do that, but they can also, maybe they even have the medication here. So just talk to Dr. BADJIE. So it's important that people know that you guys offer all these services. Yeah. People that have doctors in America and or in Europe, and they want to do telemedicine, they want to have consultation, you guys can arrange those ones. But also people have prescriptions, you can give them those medications here if you are in contact with their doctor. So it's important for people to know all of this, but also subscribe to the care plan so that they can take care of their families. I have said this, I don't know if I'm going to have feast money tomorrow. I just want to make sure everybody in my home is protected, because it's important. It's important.
And I tell people too, the care plan, especially for the COVID supportive care plan, all the products that we're sending you are things you should keep at home anyways. So I think it's really important for people to realize that it's just not a phase thing. Every household should have a fever reducer. Every household should have a thermometer. People should be taking vitamins, right? But in terms of capacity, yes, I think we're one of the few companies, even though we're not even a year old, we've hired almost 40 Gambians, and we're still hiring. But our philosophy is, one, get in contact with us. Now we've simplified it. You could text 1881 from the Gambia. I guarantee you somebody's gonna get back to you. You could text us on WhatsApp on our number 2866200. It's on all our Facebook accounts. And even if the response is slow, I tell people, our philosophy as a company, we don't want to help 100 people at once. We want to help one person pay attention to their needs 100 times. And I think you've gone through the experience. So that's the same courtesy we give. And it's important for me, because the Gambia has a privileged culture, a Dugalante connection culture. I want every Gambian to have the same experience as a minister or the president would have, right? So
that's what I wanted. I'm gonna come in there. That's what I was gonna say. So I know I am that Dugalante person. When I go to the bank, I want to know somebody. I want to go to the bank. But I have been to your facility, and I've seen how everybody is treated from the door. And I have been on Twitter. I have seen the ordinary Gambians tweeting about your customer care, how customers are treated. I send people every single day to INNOVARX. Oh, go get me this, go get me this. And or sometimes I'll just say, I will call and they'll drop stuff for me. Like, why is customer care so important to your institution?
Yeah, because it's a rebellion, and I'll tell you why I'm using that word rebellion, right? For the longest, and this is my perspective, and I hope to not offend any person, right? But for the longest, I feel like Gambians have received the worst customer service in our own country. But on the flip side as well too, we don't take pride in providing good customer service to our fellow Gambians. So there's two sides. So I tell people that we are proudly, you see Gambian faces, right? We have to fight to enter the market, right? Because in our system, we see a lot of places that we give a lot of money to that don't show us that they invest back into Gambian communities. They invest into Gambian homes by hiring a lot of Gambians, but they know we need them or whatever they're selling more than they need us. So as a company, I tell people we have to be good at treating every Gambian person like they have the dignity of any dignitary. So it's just a cultural thing, because we have to break the stereotype of bad customer service. So we have to embody the same thing, because the company was designed to be something different, make somebody feel good, irrespective of who they are. So it's just continuous practice. And I don't take the credit, because I have staff members now
Yeah.
who is personal for them.
Yeah.
They want every Gambian to come and be like, okay, what did I just experience? And it's Gambian faces. And if that goes across the board, I think our country will be better for it.
Yeah.
But I think every Gambian Dalasi is valued in our company. And even moments that we have bad customer service, which will happen, we try to find ways to improve customer experiences because everybody's on the same playing field. But the Gambia, it just makes it difficult because even with COVID, I think a lot of our resources are limited because now if you know Fatu is really important and knows connections, more than likely we know Gambia, Fatu will get a test faster than Samba or Pate who lives in Sukuta or Birkama. It's just a system.
Yeah.
So we just need to protect and just kind of keep people on a same level field. But I think it's important. And Gambians is we have to be better. If we want better, we have to be better.
We have to be better. Yeah. I have few satisfied customers here. I mean, caller is saying they have the best customer service, hands down. And I know I have this person also, Alajin Gom. He's the CEO of Lotto Game. And I was the one who recommended him. And he came back to me and said, why didn't you tell me these people a long time ago? And I'm like, how did I forget about that? But he's also saying they have the best customer service. So I think it's important that people, these reviews are very important for.
And let me add something to that, Fatu, especially now. So even today, we've rolled out a curbside delivery and a drive-through delivery. Okay. So as long as you know what you want, you could place an order. We'll do the shopping for you. So when you drive to our parking lot, you literally just call and say, I'm in the parking lot, and we'll come out with the product that you ordered and give it to you. So we need, even though if you feel like, okay, delivery, because we're having a backlog with delivery, you could just drive by the facility, even if it's a town trip, call us, we'll bring what you need outside to you, and you'll be on your way. So I just wanted to mention that just find ways, every single day we're trying to find ways to improve the customer experience because we're not a company that depends on too much support from like major organizations or government. So we deal with the people. So the people's experience has to be something that at least we don't feel our conscience is clear that they're paying for an experience that's worthwhile.
That's worthwhile. Okay. Now let's come back to COVID one more time. I know that the testing is slow right now, and we don't have enough rooms to keep people. Yesterday I had more than Yai, and my concern was we are letting in a lot of people coming in through the airwaves, and that is still ongoing. And instead of concentrating on the local transfers, we're also dealing with, people imported cases. So that has brought a lot of constraint on the health facilities. So for people who have not received any, people who are not receiving support from the ministry, I know you have mentioned try to isolate yourself, but in our society, how many of us even have a room of their own? Yeah. How many of us have rooms of their own? And also some people will tell you, but all these things that you were saying, maybe we cannot afford it. What are some of the local immune support that people, the basic stuff that we should be able to take when we have symptoms, or even general stuff that we should do to help, support our vitamin, to supplement for vitamin C and stuff?
Yeah, I mean, once again, we have an abundance of fruits in the Gambia, especially during the rainy season. From kaba to mango. I mean, there's fruits that mango goes to waste in the Gambia.
Yeah.
Right. So just eating a mango or two a day will give you the amount of vitamin C that you need. Right. Eating a healthy diet as well too, avoiding a lot of oily stuff, a lot of high sugar stuff, things that your body struggles anyways to get rid of because we're not designed to consume the amount of sugar that we consume as a society. So there's a lot of things that you can do. And once again, it always goes back to, if you want to boost your immune system, the word boost, there's actually no scientific evidence behind the word boosting somebody's immune system, right?
Yeah.
So even if you don't do anything and you do the basic stuff where you're getting rest, you're not fatigued, you're wearing a mask, like your chance is not lower of getting the virus, right? But we have to understand what our Gambia reality is.
Yeah.
If we're looking at the test, about 1 in 5, 1 in 6, 1 in 4 of all the samples are coming back positive. Every time we see those results, we should assume that it could be up to 10 times higher of that amount. Because an absence of evidence is not an evidence of absence. Just because you don't find something doesn't mean it's not there, right?
It's because we are not testing as much as well. Out of 2 million Gambians, we have only tested 6,111 6,011 people. That is really low.
Yeah, and that's the thing where we have to assess our reality. I don't think on a good day we could test 500 samples, right?
Yeah.
So testing is not on the top priority right now than dealing with people who are gonna get infected. Because we've passed the stage of being able to just literally avoid community transmission. Like, and I hope people go back and watch the initial videos where if one person is infected, it's like a multiplying effect. So we just have to prepare for the worst and realize that normal would not exist again for 2020 or maybe beyond for Gambians, right? We cannot live like we used to do. We don't have the privilege of doing things like we used to do. We don't have the privilege of having naming ceremonies and weddings. We don't have the privilege of even sitting in a bantaba or a campe drinking attire, right? That is not normal anymore. We can't do that. We have to adjust our lifestyles until, by the mercy of God, and I keep telling you, only God could help us, right? Because our reality is what our reality. We can't stop it. We just have to acknowledge what our reality is and do the things we can do and pray that more people recover from it than we do lose people. But community transmission, the way it works, once it's in our communities, no one is safe, to be honest. No one is safe.
So, meaning our new reality is we have to adjust.
Yes, and we need to have our leaders, and when I say leaders, we always think government, but our religious leaders should be telling people pray at home, right? Our communities, where men's communities, women's communities, friends that get together, people have to start telling people there's nothing special. God doesn't love Gambians more than he loves Russians or Sierra Leoneans or South Africans, right? We're all God's children at the end of the day. So we cannot let every decision come from the government. I think everybody who has influence in the country of any sort should be telling people stay home, wear masks until we adjust to our new normal, and then all the things would happen again. And I think we miss that opportunity a lot of times, which is disheartening because we could have shut down for Tobaski. We'll celebrate so many more Tobaskis that we could have sacrificed Tobaskis, right? And I think sometimes the public should speak up when we see that, hey, if we're planning a state funeral, during the planning process, somebody should say, this is not a good idea in the middle of a pandemic, right? If people are having naming ceremonies or weddings, those are things that we cannot afford as well. So we literally have to govern ourselves as much as possible. Because even this weekend, I tweeted about it where kids were going for Salibo. Catawba Avenue was full of kids. Like, who are the parents? Why are the kids not on lockdown? So it's just, we've missed a lot of opportunities, which from a healthcare professional, most healthcare professionals that you talk to, it's as if we're watching insanity because it does not make sense. When this is
I saw this letter from God, I think the Doctors Association, well before Tobaski, and they were alarmed, and they just sent a warning to the ministry, to the government, to say, please do not break the existing small facility, like health infrastructure that we have. But then the surprising thing was the Ministry of Health issued an SOP for 90 days, closing businesses and the economy. But we still opened the mosque. People went to Tobaski prayers. People are going to church. Why are we, why are we not taking this seriously? We cannot just impose a closure on a certain population, certain people, and leave the others because we are scared to take these political decisions.
Yeah.
And I think it's about time for people to come out and speak openly about these things. Currently we have a state of emergency on businesses. Businesses are closed. We still have the mosques and the churches open. No one is closing those. And we have funerals. And my worry is, Dr. BADJIE, you go to people, not many people have the luxury of getting tested or going to hospitals. Nowadays, people are just dying. And you go to a funeral, you see people sitting in that funeral. They have no idea what is the status of this person that we're burying. Ordinary folks are going, the imams are praying, and they're doing that. They take this person for burial just in our normal ways. And the next minute, the pandemic is surging in that community. And this is what is happening right now.
It is. But as they say, adversity doesn't build character. It exposes character.
Yeah.
And there hasn't been a bigger adversity for the world than COVID. Yeah. So every single society, coronavirus is bringing out their character as a society. Yeah. So I think a lot of times when this is all said and done, I hope we reflect on certain things that need to change in our society, certain stigmas that need to go away, certain acts of denial that need to go away. And leadership is not the government's responsibility. I tell people, yes, the government, if people want to say they missed the opportunity to close the mosque, that's fine. But all the mosque communities could have decided to tell all their congregation, we will not have Eid prayer, stay at home. So the responsibility has to be shared, because I think there's just a lot of issues besides Corona that hopefully we just need to reflect on and see how we could improve the government, because I think it just goes beyond, it's just a reflection of our character, and this one is just an expensive price to pay because people's lives are involved. So we could only hope, that we have better opportunities to have better conversations. A lot of Gambians hide diseases that they have. They don't speak up about it. Yeah. So if you're hiding or you're in denial about a disease that is infectious, right? The harm is, there's a multiple ripple effect. So the stigma, the denial, and it transcends beyond COVID. I mean, you could talk about the amount of Gambian women who are getting raped, and people are not having honest conversations. That's a whole pandemic on its own, right? So, but it just shows you the stigma where we don't hold people accountable. We don't have certain conversations that are uncomfortable. I think the moment the country's comfortable having uncomfortable conversations, society will be better for it. And that goes beyond healthcare. But it's just really, really impactful from a healthcare standpoint.
The stigmatization is very important. Yes. I was amazed when I saw few people coming out and talking about being tested. But still, we are still yet to see people fully coming. They will tweet about it and say, but just coming out, being advocate for the disease. And I'm expecting that one of our ministers will come out and tell us their experience. That will give a lot of
absolutely
weight to the fight against COVID. Because it saddens me. I know of somebody who tested positive, and the person was waiting for help at home. And at some point, the family threw her out because they said, you cannot stay here anymore. And she had to go look for somewhere else to stay. At one time, she wanted to speak. Actually, she did speak up and did a video. But at some point, she had to tell people to delete it because the family were telling her this is yang ñoo indil roots to swing family. Until we speak about this virus, how it attacks us, how it's affecting the people that are affected, we will not be able to fight it. And this is where everybody, especially people that have a voice. I have said this, and I think I've said this on our show. I'm not praying that I have it, but once I've tested positive, I will be an advocate because it's important. for people to say, oh, Fatou de sa amna ko, mu nge wax li, mu nge wax bes bu nekk lim de feel si yaramam bi, nii la ko dee def, nii la ko dee def. That will hit the nail on the head. People will start believing it. So that's why I think our leaders that are affected right now should just help educate our people and come out and talk to the people. Somebody like the vice president, if she is able to speak out on video in our local languages and talk to the people, that will be very helpful, because I think it's about time. Because I mean, UK's prime minister was tested positive. He's recovered. He's doing his work. People are getting recovery. So it's important for people to come out and talk about their experiences. This will help in the fight against the disease. And this is one thing that is lacking in this country right now. People are hiding. People are just, some are tweeting, but for people to come out and, you know, speak up openly on camera to our people directly, it's still lacking. And I think that is one thing that would help in the fight against the stigmatization.
100%. And even, I mean, I got tested yesterday because obviously my exposure, I've been in contact with somebody who has. For one, the testing experience is not bad. There's way more worse things than 2 seconds of somebody getting a swab of the back of your throat and inside your nostrils. So, but I cannot tell you how many people that are having symptoms that I'm having to negotiate with them to agree to get tested, right? Which is so interesting, but stigma is a problem in our society. And once again, we cannot expect to build new character or change our traits when we have a sutura problem. So if somebody in the family rapes a child, sutura lenko, in the shame, right? We do these things and it's normal. So when a health crisis happens, we can't expect people to change their behavior when there's a lot of people, young people don't get tested enough for STDs, don't get tested enough for HIV, right? So don't get tested for their blood pressure, their blood sugar. We're not a preventative society. So these challenges are gonna be hard. And even when the vaccine comes out, you'll still have the conspiracy theorists will tell you, oh, maybe some people are trying to put something into Africans, so don't take the vaccine. So it's just a struggle, but I think more people, and I think we have to give credit. There's some individuals who are coming out with their story, telling people I tested positive for COVID. We have to commend the vice president as we, you know, rate all the ministry cabinet ministers who are recovering. But more people that talk about it. But once again, in our households, we should not hide when somebody is getting symptoms, right? Because we have to realize the human element, the love element. If somebody's wife or husband for X amount of years has really bad COVID, they're coughing, they're sneezing, they have shortness of breath, at the back of their mind, their natural instinct is just help them. So at that point, they're not wearing masks, they're not wearing gloves, they're not, you know, hand sanitizing before they pick them up. It's just natural to just run in and offer care, which is why households are gonna be tricky, because you don't think, if your child is sick, you don't think, okay, let me find a pair of gloves before I help the child. It's just natural for you to come close, which increases your risk of exposure. So one person in the family can end up with the whole family having it. People are, you know, so it's just a really, really tough situation. But every single trait as a society, which is detrimental, which we should have addressed a long time ago, COVID is not only gonna bring out and expose it, but hopefully we could know that we have to be, stigma is something that we should let go, because it's just not conducive to our society.
And finally, what should be our messaging going forward now that we are at this point, the current situation? What should be the messaging to our people, the folks in the communities?
Well, hope, we can't lose hope. We can't, you know, go into a state of desperation. But like, there's a paradox that I believe in, that it's more, every single day you have to have faith that you will prevail in the end. But at the same time, you have to be totally honest with your current reality, however brutal it is. Our current reality is our reality. What we can do is try to protect each other and do the little things for each other, right? And then when symptoms do happen, when corona does enter our households, when we start losing people we love, let's also remember that we're humans, will have to go through stages of grief. A lot of people may not have to be able to see their loved ones before they get buried, but it's once in a lifetime. Pandemics has happened. You know,
Yeah.
1918, there was a pandemic. You know, Gambia has a history. Places like Afdai comes from places where you lose a lot of people at a short amount of time, where almost half the population dies. That's where Afdai, the name comes from, right? So this is gonna be our moment as Gambians to go through together. But once we get out of it, on the other side, I think there's a better Gambia. I think healthcare will be taken more serious. I think technologies like telemedicine would be used. I think we'll be closer as people, and hopefully stigma could be something that Corona takes away as well too, where we just have be comfortable having uncomfortable conversations,
Yeah.
especially when it comes to health, when it comes to social issues like gender violence, rape. We have to address these things head on because those things have affected, and silence is something we cannot afford when it comes to certain things.
Thank you very much, Dr. Baji. What a great conversation. I'm sure a lot of the people that are watching, I'm looking at the comments and they are enjoying this conversation just like I have done. So many people will also take their own personal precautions. It's important for us to all take our personal precautions in fighting this virus. For those of the people that are watching who don't know your address, one more time, tell us where you guys are located and how do we get in contact. Now, I know a lot of us would not want to go to health facilities, but because you have this support care system, what numbers should they call if they need help? And I think that would be important.
So yeah, we have a simple code now for the Gambia. You text 1881 and somebody will get back to you. Even if it's slow, I guarantee you somebody will get back to you. On WhatsApp, our business account on WhatsApp is 2866200. That's 2866200. But if you go to our Facebook, our Instagram, it's just at INNOVARX Global, INNO, V as in Victor, ARX Global. And for all your shopping needs, you could come to the facility, but we will take the process of you having to come and shop. One of our wellness consultants will take their time to see what you need. We could prepare the order for you.
Yeah.
You could either stay in your car, we'll bring it to you, or our delivery drivers, our WOW team, our Wellness on Wheels team, will deliver it. For people up country, we do deliver from Banjul to Basse. The only difference is it may not take 2 hours for somebody who lives in Bansan, for example, but you could still order products and we will coordinate logistics to get it to your loved ones, because people who are not in Combo deserve just the same amount of care as people in the Combo.
Wow, it's always nice to have this kind of conversation with you. I've always said this. I do this because I personally get equipped myself. It helps me to know the virus more. And my friend is saying my 800 milligram ibuprofen, he's obsessed with medication. he's obsessed with INNOVARX. And every single day he calls and talk about the services that you guys have offered him, how he's recovering. I do know we have traveled so many times to go to the US for him to see the doctors. And he spends thousands of dollars to get to the US and get medication. And he's getting all of that here. And he is so overwhelmed with that because it makes life easy, and also it's cheaper. And definitely we want to thank you for the services you offer to Gambians. I just pray and hope that this is the standard that continues, because definitely a lot of Gambians, the reviews are good. A lot of Gambians are satisfied with the customer services. I see it every day on Twitter, and most of the time I tweet it because it's just what I feel myself. And we want to thank you for your service, and I also want to personally thank you for some of the support you have rendered to some of my friends and family during this period, and I want to thank you. And that's why I've always recommended, I don't do this all the time, but I've recommended this business to a lot of people because, I personally have experience with you people,
Thank you.
and thank you so much for everything.
No,
And I
thank
want to
you.
thank my star. She's watching. Fatim, she's
Yeah.
watching. Lolin Benga and yeah, Mariam Sala, Alajingom, and your baby sis Aisha is also watching. She's so
There you
proud.
go.
Oh, yeah.
They're my support system. I only go as they go. They push me, so they're the
Yeah,
support system.
yeah, yeah. Thank you very much, Doctor. It's a
Thank
pleasure
you.
talking to you. Yeah, I hope to
Thank you.
have you one more time before
Definitely.
we end this series, just to check on how you guys are doing and you know how everything is going. Yeah.
Absolutely. Thank you. Stay safe.
Thank
Thank you so much, brother.
thank you so much. Thank you.
Uh,
And to you guys watching, this brings us to the end of this program. I have Dr. ISMAIL BADJIE. Doctor is the CEO of INNOVARX Global Health. I have said it. I have worked with this business. I am that person who does not go to any hospital. I'd rather take my Tylenol or Advil, but this is one place I go, not just because of knowing them, but because of the services they offer. And they will come to your office or to your home to take care of you. And for you in the diaspora, and you have family members who are in the Gambia, and you want them to have supportive care, it's important because a lot of us here, you know, when you send money to your people, oh, go get your medication, Manduala Fale, we will use that money for something else. So you can do it yourself. All you need to do is call one of these numbers and register a family member, send them a message, and they will register this person, and they will call them every single day. They will provide the supportive care and also call them to check on them. I think at this point, I have said it many times on this show, it's everybody for yourself. Everybody should take care of themselves and make sure we are looking after ourselves and our family members. I know when the numbers started increasing in Gambia, a lot of you in the diaspora have been worried. So many people called and said, we are so worried about the situation in Gambia. Yes, we are all worried, but we just don't have to be worried. We have to also support our people. How do we support them is providing the basic necessities. I think every home should have a vitamin. Every home should have a thermometer for people just to check their temperatures. Have painkillers where people can have pain relievers. All those things are basic stuff that we should have home. If you are back, if you're in the diaspora and you can support, I think it will be important to do that. The government cannot do all of this. They're overwhelmed. There are so many people, there's so many cases. They cannot. That's why private individuals like this come in place, so we can seek support from them and make sure they're taking care of our people, especially the elderly people and people with underlying conditions. I want to thank you all. Somebody's asking, what about people that live in Nomi? Yes, they do service people across the country. I know there are people that in Basse, they're servicing in Bansang. So their services is offered to people across the country. So if you have people, this number, the 2866200, is their WhatsApp number. So you can call them and register for their services. I swear, the reason why I am advocating for this, because I personally have dealt with them. When COVID started in March, I was sick. I felt like I had some symptoms. I was not coughing, but I had body ache and I had headache. And I was worried. And I spoke to Dr. BADJIE over the phone. And accidentally, I just spoke to, I just checked for his number and I spoke to him. I invited him on the show. But before we started, before we did start the show, I had a conversation about how I was feeling. And I was worried. And his first thing to me was, so I know you are also stressed because you're thinking about the disease, but for you to even help your immune system, you need to stop worrying about it, because you know, if your stress level is high, that's going to affect your immune system. So I never knew that. And that was the first advice. And he recommended some vitamins. Before we even finished the show, he did send his team to send me some vitamins, some cough syrup, some pain relievers, the thermometer and everything. And I started myself on that plan. And then I started my dad, I started my grandmother, because I know they are high risk, they have underlying conditions and they're much older. But today I can tell you, I feel so good. that my family members are taking this plan, and every other day they will call to check on them to see how they're feeling. And it's important that empowers you. You know, yes, you can get infected, but knowing that you're doing the right things, you're taking the right supplements, you're taking care of self alone, you know, takes away the stress from you. That is why I feel that I wanted to share this with you. So every Gambian should have a Dr. BADJIE in their corner. So I'm recommending that. The number is if you are in Gambia, all you need to do is text 1881 and they will respond to you. But if you are in the diaspora and you want to register for somebody, I think it's plus 220-2866-200 plus 220-2866-200. I just pinned the number here on the show. For those of you watching, this is the number, and if you're going to watch this show later on, that's the number out there. Thank you very much. Tomorrow we'll be back again at 3 o'clock with another health official. I wanted to bring in some other people, but it's a little late, so we'll do that tomorrow. I'll bring another health official. Let's talk COVID-19. This is a series we will do maybe 4 times a week, just to empower our people to know more about the disease. Thank you very much, and see you tomorrow. Bye-bye.